Good afternoon, everyone. Welcome to today's session. Thank you all for joining us, and a special thank you to Martha Kelso for being our presenter today. Martha will be presenting on the legal and medical implications of fluorescence imaging for detection of elevated bacterial burden. After her presentation, there will be a short Q&A, so please use your chat icon to put any questions you may have into the chat. We will try to get through as many as we can. I'll now turn it over to Martha Kelso, CEO of Wound Care Plus. Thank you, Martha.
Thank you, MolecuLight, for asking me to speak on a topic that's kind of near and dear to my heart. I've been a legal nurse consultant for the last several years, and I'm currently the editor-in-chief for the Association of the American Legal Nurse Consultant, the AALNC, for their journal publication. So legal and medical implications is important. Let's move on to the next slide. I'd like to make sure that everybody's aware of the disclaimers for MolecuLight, and you're welcome to peruse that on your own as we advance to the next slide. Here's some interesting statistics about wound litigation. An average settlement of a pressure ulcer lawsuit is $250,000. We do know that there's some awards topping $312 million. Wound litigation is very real, and plaintiffs are favored in up to 87% of these cases. That means if you're defending yourself in wound litigation, your odds are not very good of winning the case, so to speak. We know pressure ulcers are highly litigated, and it's the second most common cause of civil suits alleging medical malpractice, superseded only by wrongful death suits. Those numbers are staggering. More than 17,000 lawsuits are related to pressure ulcers annually. And that was pre-COVID. These are pre-COVID statistics. We're not including pressure ulcers in litigation that are brewing from 2020. About 60,000 patients die as a result of pressure ulcers each year. Also a staggering statistic. Let's talk for a moment about the anatomy of a lawsuit. What I mean by anatomy is what are the required factors before a lawsuit can be entered on behalf of the plaintiff or entered on behalf of the defense. So in order for a plaintiff to bring a civil lawsuit against a wound care clinician or wound center, the plaintiff is obligated to prove certain elements. And these are elements that I look at as a legal nurse consultant to verify that the case has merit. So the very first thing is, number one, that a duty was owed. So if you're the provider, that patient's under your care, then that means a duty is owed to that patient. We also look to see if there was a breach of duty. Did the provider deviate from the accepted standard of care for the pressure ulcer? Now, standard of care is an interesting term. Standard of care, of course, could be something that was written into a regulation, could be written as a best practice standard, something that could be authored in a peer-reviewed journal, or simply something that's readily accepted, or multiple people in the industry do it because they believe it's the right thing to do. Therefore, a standard of care. The third thing that we look for is that some kind of injury occurred and that injury was caused by the breach of duty. Oftentimes in a wound litigation case, we're asked if someone with same or similar credentials would have done the same thing. Is it reasonably prudent that someone with the same credentials, background, and training would have done something same or similar to prevent worsening of outcomes? So any small breach, even in documentation, can leave the clinic and or the provider with significant liability. Next slide, please. Thank you. So let's talk about compounding factors. There are primary or secondary cause of negligent acts or omissions to act on part of the hospital staff. Keep in mind, if it's the latter, things like sepsis can be grounds for a medical malpractice lawsuit. And since sepsis is a life-threatening condition, which kills more than 70,000 Americans every year, some states' courts treat such medical malpractice very seriously. So let's look at the internal standard of care for Wound Care Plus, talking about fluorescence imaging of elevated bacterial burden, and when it's medically necessary to do the following. So I pulled this information from our database. It's something that our providers, when they're performing fluorescence imaging, will document on, because as we know, in order to bill insurance for certain procedures, it must be medically necessary. So when would medically necessary fall into play? Well, certain things like a patient having a history of delayed wound healing. Perhaps they have a history of wound infection, history of sepsis, multiple comorbid medical conditions that elevate their risk of loss of limb or loss of life. Perhaps they're on medications that delay wound healing or suppress the body's ability to fight infection. Things like steroids, chemotherapeutic agents, some thyroid medications, some antihypertensive medications have a known history to suppress or delay wound healing. The list is pretty long. Perhaps they already have an autoimmune disorder that reduces the body's ability to fight infection. In the case of Wound Care Plus, we deal with a lot of aged or elderly population that we know have immunocompromised or immunosuppressed simply due to age. Perhaps wound healing is not progressing as we would like to see fit. Perhaps they have signs and symptoms of infection at this visit. These are all items that could meet the burden of medically necessary to allow fluorescence imaging to be performed at this visit and build towards payers or insurance companies. Again, the internal standard with Wound Care Plus, if there is presence of bacteria identified that's indicative of bacterial burden in excess of 10 to the 4th power, if that wound is fluorescing, we would suspect bacterial burden. So things that we would want to document that payers may expect to see would be real-time moderate presence of red fluorescence in the wound bed. Or perhaps the wounds are associated with red fluorescence. Maybe there's cyan fluorescing in the wound bed. Maybe there's no fluorescing in the wound bed. What did we do about it? So if there are symptoms of fluorescence, whether it's red or cyan, it could warrant additional workup planned. Again, we're thinking about that medical legal charting, but also thinking about what is it the wound would need from us. So perhaps tissue culture from fluorescing areas that we obtained and submitted for microbiology. Generally speaking, we submit for aerobic, anaerobic, and fungal. Perhaps we did a sharp debridement to remove non-viable tissue from the wound bed that might be feeding bacteria. Perhaps we did labs to determine if there was osteomyelitis or some other source of infection. Education is always important, and in some sectors of Medicare, for example, WPS territory, they have considered education now as additional workup planned. So it's important to include that in our medical charts. Let's move on. So enhancing detection of bacterial burden with MolecuLight is important, not just from a medical standpoint, but also from a legal standpoint. This point of care imaging device is so important for clinicians to utilize and interpret. So I want to show you a real case. This is from Wound Care Plus. In this case, the very first photo I'm showing is a photo immediately after sharp debridement. So you can see we've cleaned up any necrotic or non-viable tissue. It's bleeding. We've got good, healthy blood flow. This is an excellent debridement that we're thrilled about. Normally, we would brush our hands off and say, job well done. We'll see you next week. But we decided to do a MolecuLight on this wound. And shockingly, something appeared that we did not expect. So that's the actual image of the MolecuLight being performed at the bedside of this wound. And you can see that it has a red fluorescence showing up on the screen. That red fluorescence was indicative of bacterial burden, but we couldn't see it in the wound bed. So the clinician got out their scalpel and pushed down into the wound, and we found a hidden abscess in that wound. Of course, you can see on the post-debridement photo, the photo to the left-hand side of the screen, that it's very close to the rectum. So had that abscess been missed for even another week, we could have had a much bigger issue on our hands, whether that was a hidden fistula or where it started to develop a sinus tract heading towards the rectum. Without that red fluorescence on the image, we probably would not have suspected that that abscess was there. Keep in mind that with MolecuLight, it is non-invasive and there is no patient contact required with this device. Next slide, please. In summary, we know that pressure ulcers and other wounds have a high litigation rate due to being pressure ulcers or even sepsis. Standard of care methods to identify bacterial burden are inadequate. We know oftentimes clinical signs and symptoms may not exist until the infection is so bad they are septic and we're sending them out to the ER. We want to capture bacteria that's causing issues with the wounds early on and adopt these as standards of care as Wound Care Plus has. That point of care fluorescence imaging can help reduce liability by improving detection of elevated bacterial burden and supporting comprehensive documentation of care. This is not a substitute for an adequate wound assessment. Wound assessment comes first, and then fluorescence imaging would be utilized during your assessment, during the visit. I think we're ready for questions now.
Thanks so much, Martha. That was fantastic. So
Absolutely.
if anyone does have questions, please put them into the chat box within this Zoom session. And I'm going to start it off with a question I've asked you already today, Martha, which is, when Wound Care Plus is doing this, what are your providers indicating on how frequently they're actually changing their treatment based on the fluorescence information?
That's a great question. We had a company conference call just a couple weeks ago where we asked that question to our clinicians, and the response was anywhere from 80 to 95% of the time. And it was shocking because, you know, you've already got the treatment plan in your head. You think you're done. Well, it's not acting like I want it to act, perhaps. So let's do a MolecuLight, and they're shocked at what they're finding. And so it's changing the way they practice, changing the way that even the way that we do tissue cultures, how we, you know, before we weren't quite sure where we were going to get that tissue culture from in the wound. Now we're able to target exactly where that culture is being derived.
And what would be the most common intervention that they would typically do when they see the red or cyan signals?
The number one thing that we would typically do would be to debride and see if we can't remove any non-viable tissue or senescent cells that may be feeding bacteria. But then after the debridement, we can fluoresce again, see if there's still bacteria in the tissue. If there is, we would stop and get a tissue culture and get that sent in.
And can you tell us anything about the reimbursement pathway in the facilities in which you're working in?
Sure. We were able to petition Medicare WPS territory. So I'm taking off my MolecuLight hat and putting on my Wound Care Plus hat. But back in October, November, we petitioned Medicare asking them to provide coverage for this device for this test in long-term care. And Medicare came back in WPS territory and said, absolutely, this makes good sense. So we were able in a long-term care setting to start billing for MolecuLight. And in January of 2021, Medicare unbundled the payment so we can also do it on Medicare skilled, Med-A skilled patients and not bill the facility. We're now able to bill Medicare for that. It's very exciting.
Fantastic, fantastic. Okay, well, that is all the time we have. These sessions go so quickly. Thank you so much, Martha, for joining us today. And I just want to let everyone know that if you have any other questions, please stop by the MolecuLight booth in the exhibit hall here at WoundCon. We'd be happy to share some additional information. There is information on the reimbursement pathway there, in addition to ways that you could request a demo either on site or virtual, which is something we've gotten very used to doing in these strange times.
Yeah.
Thank you so much, Martha, and to everyone.
Yep. Thank you so much. Bye-bye.